Welcome to Beyond by Wings, the business side of dentistry, brought to you by Edwards and Associates PC. Join us as we discuss how to build your dental practice, optimize your income, and plan for your future. This podcast is distributed with the understanding that Edwards and Associates PC is not rendering legal, accounting, or professional advice. Listeners should consult with their business advisors before acting on any of the information that is shared. At Edwards and Associates PC, our business is the business of dentistry. For help or more information, visit our website at enassociates.com. Hello and welcome to another episode of Beyond by Wings. If you've been waking up lately feeling like your battery is permanently at 5%, or if tasks that used to take you 10 minutes are suddenly taking you an hour, I want you to know you should take a deep breath and that you're not alone and you're not failing. It is the month of May, which means it's Mental Health Awareness Month, time to strip away the stigma and talk about what's actually going on under the hood. And today, we're tackling a monster that has quietly moved into so many of our lives, burnout. To help understand what burnout actually does to our brains and how we can genuinely claw our way back to balance, I'm so incredibly grateful to welcome our guest today. She's a mental health counselor, and her name is Priyanka Abul Khair. Priyanka, welcome to the show.
Thank you, Ash. I'm really glad to be having this conversation.
Good. And it's an honor to have you on our episode. I believe we did an episode a long time ago, but it's been a while, and I figured, why not bring you back so we can cover this very vastly spoken about topic, burnout. Now, most dentists, or even most people, they describe burnout as, I'm just tired. What's the version they think they have, and what is it actually?
Good question. Most dentists, since we're talking about dentists, describe burnout as workload exhaustion. I'm just tired. The cases aren't even that hard, but I'm wiped. I used to love this, and now I dread Mondays, right?
That's right.
That last one is interesting. Dread is not a fatigue symptom. Dread is an anticipation symptom. You don't dread something you're not actively worried about. So when a dentist says, I dread Mondays, when he's telling us is that something specific is waiting for him on Monday that his system is bracing against. And it's almost never the cases. It's that 6 unresolved conversations and the 3 difficult team members and the patient complication from last month that he keeps replaying. What it actually is a relational and nervous system exhaustion. The cases didn't get harder. Carrying everything else got harder.
Okay, so what I'm hearing and understanding is that burnout isn't necessarily a workload problem.
Mm-hmm.
So would you mind expanding on that a little more?
Sure. That's actually, so there's an example that I often use is what we call is the vacation test. Okay. If your burnout was really about workload, vacation would fix it. You would come back rested and you would feel like yourself again, right? Mm-hmm. The fact that most health professionals, or in this case, dentists, come back from vacation feeling great for 2 or 3 days and then crashing back into the same state, that's diagnostic. It means whatever is depleting you isn't downstream of your hours. It's something you brought with you on the plane and brought back home. And that's almost always what I call is the open loops. They don't take vacation with you.
Okay. So open loops. Can you walk us through what that looks like in typical practice?
Sure. Picture Wednesday morning, Dr. K.
Okay.
I'll come back to him throughout. Walks into his office at 7:45 a.m. Before his first patient, here is what's already running in the background of his mind. He needs to talk to the front desk about a balance dispute she handled badly last week, but he hasn't. He's been meaning to give his associate documentation feedback for a month, but he hasn't. His lead hygienist has seemed very distant in the last two team meetings, but he hasn't asked her about it. His office manager made a sharp comment to the new assistant on Friday that he should have addressed, but he didn't. His wife brought up work life balance on Sunday and he changed the subject. And the last one is his CPA wants documents he hasn't sent. I'm sure you hear that a lot.
Certainly.
Now he sees his first patient. He is a great clinician. He's been doing this for a long, long time, fully present for the procedure. But every break between patients, the loops come back. Every drive home, they come back. Every Sunday at 4 p.m., they come back. By Friday, he's not tired from clinical work. Remember, he's great at it. He's tired from running 8 different conversations in the background of his head for 5 days straight.
Hmm. So it sounds like open loops are kind of tied to avoidance of some sort.
You could say that. Many times we have known or we have seen that a lot of financial pressure is a real issue, right? We may
That's true.
say that at this
Money's a
point,
problem. Yeah.
yes, it's a huge problem. And, we've heard
Or
in,
worrying about it, rather, I should say, is the problem, right?
yeah, worrying about it,
Constant stress about it or around it. Yeah.
but financial pressure is real. It's a severe issue. And in one of the episodes, I believe there was an episode there that there was talk about the financial pressure and about underutilized benefits like
Wait,
disability.
you're talking about our episodes Beyond Bible Wings?
Yes.
Of
So
whom?
I believe it was Nick
Nick
Henshaw.
Henshaw. Yeah, yeah, yeah. Now I remember that episode. Okay.
Yeah. So I know you all talked about the benefits, the disability, group
That's right.
plans, which are very genuinely important.
Mhm.
Absolutely.
For our listeners out there, Nick Henshaw is an insurance benefit provider, like a third party who can help you with group plans, group policies.
Yeah, so what I'm describing at this point about the disability, the group plans, all of that being important, but what I'm mentioning right now is a totally separate access. You have a fully funded disability policy, a great group plan, and
Mhm.
still be running on empty because the depletion is not financial, it's relational. And the reverse is also true. You can fix the relational exhaustion and still have a financial stress problem if the practice numbers aren't working. Most dentists or most practice owners are dealing with both axes at once. They reinforce each other. So, today I thought let's talk about the axis that almost no one names because Nick did cover the other one very beautifully talking
Referring to.
about is a mental health aspect of it, right? For instance, oftentimes I've heard that there is a huge shortage of hygienists, right? When hygienists are quitting or not, you can't really find, they're like unicorns. What should we actually be looking at, right? The first place we usually look at is compensation, right? Sometimes we ask ourselves, did we lose her on pay? Did the practice down the street offer her more? Sometimes that's true, right? But in my experience, when a top performer leaves, money is the story she tells in the exit interview, the exit conversation, not the reason she actually left. Where the owner should be looking is at the conversations he didn't have in the 6 months before she gave notice. That's where the answer lives.
Okay, interesting. So it is true because I do vastly talk about the financial aspect
Mm-hmm.
of, keeping team members on board. And when I do talk to, let's say, a client that recently lost a hygienist and is currently in the market looking for a hygienist, you're right. Their first go to, in fact, the only go to is, oh, it must have been compensation. And in our industry, the hygienist compensate, because you mentioned hygienist, so I'm going to touch upon that just a
Mm-hmm.
little bit. Hygienist compensation has skyrocketed in the last
Mm-hmm.
5 years. And I do understand why dentists or practice owners, their first fallback is, okay, you know what? The practice down the road must be offering more to their hygienists. So, and
Mm-hmm.
I'm still maintaining that same pay rate from 4 years ago. So that must have been the reason. And I do agree, because I talk quite extensively with my clients about this. And you're right, almost across the board, they always think it's compensation related. I
Absolutely.
don't think they even consider, even for a second, that it might have been something else.
Mm-hmm.
But you are raising the point that there's a mental health aspect, right? And you also mentioned that I know it was an arbitrary number, or I'm guessing it is, that the 6 month time frame before she decided to put the notice in. Right? So
Mm-hmm.
things must have happened, or rather,
Mm-hmm.
lack thereof, conversations that didn't take place that caused this person to put in the notice.
Mm-hmm.
So you're saying that it wasn't like a split decision, right? Like, oh my goodness, you know what? I just spoke to my buddy. She's getting, I don't know, $10 more per hour, and I should quit and apply for a job somewhere
Of
else
course not.
where they're paying more. Okay, so
Of
you're
course.
saying that they took some time to ruminate on this.
Oh, absolutely. We all
Okay.
do. And oftentimes I do notice that these conversations come up in any kind of, especially with health practitioners, right? That we often think that, oh, this person that was one of the highest performers just took up and left, right? And you'd think that the least performer would leave first, but that's not true. The highest performers leave first because there are two things that comes up a lot, and they're in compound. They're kind of together. The first is what we call is an attachment style. A lot of high performers, you're going to notice, not all, but a lot, have what we would call an anxious or anxiously attached relational pattern. They care a lot. They read the room. They want to be valued. That same wiring makes them excellent clinicians and excellent team members, right? It's also what makes them exquisitely sensitive to dysfunction in the workplace. They feel it long before anyone else does what's coming. And the second reason is more practical. When you avoid addressing an underperforming team member, and we'll get to why owners do that later, your high performer is the one absorbing the slack, right? This is the person who's staying late. This is the person catching things at the front desk. This is the person who's mentoring the new hire informally because no one else will, but that person will do it for a while, and then they will do it silently, and then they'll be gone. So the lowest performer in your practice will never leave first. That lowest performer is comfortable. It's the person you most want to keep who feels it first. That open loop.
I mean,
Mhm.
I would have never thought of it that way, so that's good. That gives me an interesting perspective. And you're right. I do believe business owners, clinicians, as you point the phrase, open loop.
Mhm.
Um, Part one of their open loops would certainly be that fear that, hey, what if my
Mhm.
providing team member, a producing team member like the hygienist, or my top performers, let's say the treatment plan coordinator, front desk, they leave. So you brought up a good point, and the attachment style.
Mhm.
Honestly, okay. So
Mhm.
please continue. I didn't realize that that would be relevant in our burnout conversation, but I want to see where you go with this.
Well, I don't want to nerd out on attachment style for too long, but
Mm-hmm.
what that is, in short, is basically how you It describes how you interact with people, how you make relationships, how you trust, and how you respond to relationships. That's
Mhm.
what attachment style is, in short. Okay.
Mhm.
So a person who's anxiously attached, obviously constantly worried about what other people are doing, right? And they're taking a
Mhm.
lot on themselves to correct it. So let me give you an example, right? Let's call this person Maria. Okay. 12 years of experience, very, very strong clinically, beloved by the patients, 6 years with the practice. There's another team member at the front desk who's chronically late, right? Doesn't follow the recall protocol and is sometimes short with patients on the phone. Maria here notices that. And the owner notices it, but nothing happens. Maria starts staying 20 minutes late to make her own confirmation calls because she doesn't trust the front desk. She walks patients personally to the desk because at this point she's worried about how they'll be treated at checkout. None of this none of this is in her job description, right? She doesn't complain, she just absorbs at this point. And every week she's running the calculation in her head, I'm carrying more. The person not pulling her weight is being treated exactly the same as me. The person in charge, in this case the owner, clearly knows and isn't doing anything. So no race can fix that, right? Because the underlying message she's internalizing is I don't matter enough here for things to change on my behalf. That's a real wound. Money on top of that wound feels like a tip, not like being valued. So that's like an example of what that high performer could look like, right? Now comes to this point where you could ask, like, hey, how did I not see this? Or like, was she really actually communicating this before? Or what was happening? Yes, she was communicating it before, just not the way the owner was trained to recognize. She communicates by being quieter. She stops suggesting things in team meetings. She stops staying for those lunches, right? She stops asking about the practice's plans for the next year. And those are the signals, right? If you are an intuitive leader, that those are things you're going to notice. Even if you're not like an intuitive leader, like you're going to notice these differences and shifts, right? They just don't look like signals if you're not trained to read them. And by the time she actually says, I'm giving notice, she's she's gone.
She's
She's
already checked out.
been,
Yeah.
yeah, she's been gone emotionally for months now. The resignation is just a paperwork catching up to a decision her nervous system made a long time ago. So that's that,
Hmm.
right?
Well, now let's connect this back to the owner's burnout.
Mm-hmm.
Maria leaving, Maria in your example, right?
Mm-hmm.
It doesn't necessarily reduce the owner's exhaustion,
Mm-hmm.
right? Does it deepen it?
It definitely does because he's now working short. He's
Mhm.
covering recall himself on top of his clinical day. He has to interview, hire, onboard, retrain. He'll work harder, which is exactly what his depleted system can't sustain. So now he's more burnt out, less capable of having the next hard conversation, and the cycle compounds, right? This is the loop most owners are running and almost no one names it. So avoidance creates this kind of depletion that creates more avoidance, creates top performer turnover, creates more depletion. So once you see this loop, you can step out of it. That's actually a lot of the work I do with a lot of people, with my clients. It's not the surface symptom, but the loop itself.
Mm, I'm fairly sure a lot of our listeners, especially the dental practice owners, are right now nodding their head. Now, why do you think they're avoiding this conversation? Why is it so hard to have this conversation?
Well, this is the most important reframe of this whole conversation because we tell ourselves we are avoiding the conversations because we are too busy or because we are conflict averse, or because we don't have the spine for it, right? None of those are accurate. What's actually happening is what we call as a freeze response. Okay. For most people, interpersonal conflict registers in the body almost the same way as a physical threat. Heart rate goes up, breathing goes shallow, throat tightens up, the words you rehearsed in the car disappears. That's not weakness. That's we call is the vagus nerve in our body, the part of your brain that does nuanced communication. That's your prefrontal cortex. Essentially goes offline because that's where you're making all these rational decisions. So when an owner postpones these conversations, he's not making a rational decision, right? His prefrontal cortex is hijacked. He is being managed by a nervous system telling him accurately by its own logic that something dangerous is about to happen.
Well, why is there this generic burnout advice, right? Like manage your stress, take a vacation, set boundaries. Not enough to break the loop. Why is it not enough to break the loop?
Well, before we get into that, I wanted to address something that there's a crucial connection between what our brain is trying to do, right?
Mhm,
And that's because of the evolutionary reason. For most of human history, being expelled from your social group was a death sentence. If your
mhm.
tribe rejected you, you didn't survive. So your nervous system encoded social rejection as life threatening. And that wiring hasn't updated for modern life. That's just how our brain is, right? Which is why telling someone you need to give them difficult feedback can produce the same physiological response as being threatened with violence. It's not in their head, it's in their body, right? So there is a crucial connection in there because your capacity to override the freeze response is a depletable resource. So when you're rested, regulated, supported, you can push through the discomfort and have the conversation. When you're depleted, burnout, you can't. The freeze wins, right? At this point, you're frozen. So, burnt out dentists or practice owners avoid more conversations, which deepens the burnout, which makes the next conversation even less possible, right? So, the freeze response and burnout are in that feedback loop. This is why generic burnout advice doesn't break it. Stress management is not the concern, right? Because all that advice assumes the problem is excess input, meaning you're doing a lot more than you need to. Stop doing so much, take more time off, say no more often, right? These are the things you hear. But the problem isn't that. The problem is unresolved relational threads, open loops that have nothing to do with the input. You can take all the vacation in the world, and guess what's going to happen? The open loops are still waiting for you when you get back to that office, like Dr. Kim or Dr. K in this case, right? You can set boundaries with new commitments, and the existing avoided conversations are still sitting there. So, stress management doesn't really have anything to do with that. What actually breaks the loop is rebuilding your nervous system's capacity to tolerate the discomfort of having those difficult conversations. That's specific work, and that's what I do.
Now, wouldn't you agree that some business owners are better at having these hard conversations than others? I mean, what do you think it is? Is it their personality, training, upbringing?
Well, mostly upbringing, I would say, because this is where attachment comes in again. People who can have hard conversations cleanly, almost always, grew up in an environment where hard conversations existed and could be repaired afterward, right? If your model of we had a difficult conversation was someone yelled, slammed a door, didn't speak to anyone for 3 days, then as an adult, you're not actually avoiding the conversation. You're avoiding what you believe always follows the conversation, the consequences. You're protecting yourself from the rupture you watched as a kid, right? So the freeing part of this is and I say this to anyone who's listening right now, is that you're not broken. Your nervous system is well trained, it's wired, it's just trained for an environment you're not in anymore. The work isn't about fixing yourself. It's about updating the training. It's like, you have iPhone 11 and you're trying to work out in this new iOS. It's just a very backdated hardware at this point.
Since we're talking about loops
Mhm.
and we're talking about leaders and business owners, that leads me to think, are there any patterns that look like productive leadership but are actually like burnout coping mechanisms?
What I see constantly, and they look like leadership, they don't feel like avoidance to the person doing them, right?
Mhm.
And they all guarantee deeper burnout. Here's the thing. First is tightening up the systems, meaning burnout owners or burnt out owners gravitate towards systems work because it feels like progress without requiring the depleted resource, which is emotional capacity. Writing a new policy is cheaper for your nervous system than addressing one specific person, right? So instead of telling the office manager her tone needs to change, you add a communication standards section to the employee handbook. You're not solving the problem, you're laundering it at this point, right? Second is overfunctioning, doing everyone's job to avoid managing them. Delegation is a problem, right? The dentist or the practice owner who does his own confirmation calls because it's faster than retraining the front desk. The owner who personally handles every patient complaint because no one else does it right, right? The control. That's not high standards. That's burnout dressed up as control, right? The third thing I've seen is using the calendar as a shield, right? You keep on telling yourself or others, I'll deal with it after the quarter. I'll handle it once we get past the build out after tax season, right? The list of conditions that have to be true before the conversation can happen keeps going. That's the freeze response, wearing a professional clothing. That's exactly what you're doing. You're just staying in the pattern.
I'm thinking about control
Okay.
because, you know, everything that you've said up until this point, it does feel like the avoidance stems from having the sense of not having control over it. Like, for instance, the example that you use, instead of having a conversation with person so and so about their tone, you end up writing a new, you know, standard in your employee handbook.
Mhm.
Uh, because I'm trying to put myself in the practice owner's place, and I'm thinking,
Okay.
you know, it is true. When I'm writing that new standard in the employee handbook, it's I have full control over that. But if I were to have a face-to-face conversation with this person, I don't have control over the reaction or what they might do,
Right.
and that's a scary place to be at.
That is because it's human component. There are no numbers in it.
It's interesting that we're talking about this because, you know, especially if we're talking about rectifying certain acts or going or having our team members or a specific team member to go about things a different way, we also have to bring up accountability. And you also did a recent episode with Dave Rosenberg, and he talked about assigning radical accountability to a single person, not the department. Is there
Mhm.
any way what you're saying could connect to that?
Absolutely. So this is how it goes. It connects directly from what you're saying. Because from his point, if he's talking about radical accountability, it's it's actually a tell, right? Owners who can't have the individual conversation will instead create a department-wide rule to avoid naming the actual person. So they'll add a policy about team communication standards, right? Rather than having that one conversation with one office manager about one specific behavior. Then they will congratulate themselves on tightening the systems. And I understand, like Dave Rosenberg talked about it from a more systems perspective, right? But
Mhm.
from the psychological side of things, the reason it happens is that adding a policy doesn't trigger the freeze response. It's safe. Naming a specific person and giving them specific feedback, that triggers it. So owners flee to the policy and the problem still remains.
But going back to, earlier
Uh-huh.
talking about, you also mentioned high functioning, over function, right? And
Mm-hmm.
I was just thinking that that's also interesting because sometimes it doesn't look like burnout. It may just
No,
look like, the owner slash dentist, they just have high standards.
that's
Is there a
right.
way for them to tell the difference between, okay, I just have high standards. That's why I'm high functioning. That's probably why it appears that way to you versus no, I'm actually on a pathway to burnout.
Well, you can actually. There are a few markers. You can definitely look at it from a, a little bit of a different perspective here, meaning high standards delegate clearly and hold people to a defined benchmark, right?
Mhm.
Overfunctioning takes the work back rather than holding someone to it, right? So high standards say this needs to be at X level. Let me show you what X level looks like. Overfunctioning says, I'll just do it myself because it's faster than fixing how she's doing it. Okay. So another marker could be high standards generates capacity in the team over time, right? Overfunctioning generates dependency. If 3 years into your ownership, no one on your team can handle a tough patient call without you stepping in, that's not standards, right? That's systems you have built to keep yourself central, often because the alternative, which is actually managing people, costs more than doing it yourself. So you can definitely look into that, the overfunctioning and the high standards, what that looks like. If you like spend some time, it's very obvious.
Now, would you say that burnout dentists are often the busiest dentists as well?
Has to be. Almost always, because not just dentists. Like, I want to talk a little bit more about the health professionals because I've seen that over and over again, especially high achievers, right? Almost always, I will say that. This is one of the most misleading things about burnout in healthcare. It doesn't look like withdrawal in the early stages, it looks like overengagement. The burnout dentist isn't the one who's checked out. He's the one running the practice, doing his own confirmation calls, redoing the new associate's documentation, fielding every patient complaint and quietly resenting all of it. The crash, when it eventually comes, looks like a sudden inability to keep going, right? But that let up or lead up looks like productivity. You can mistaken it for that, which is why people miss it in themselves until much later than they needed to. They're not lying around. They're working all the time. And I'm sure you've seen those dentists. They just can't figure out why they feel like they're being slowly compressed. It's miserable.
So, for an owner that is currently listening to it, let's say they recognize that, oh my goodness, that sounds like me. What should be the first step they should take to acknowledge it or to do something about it?
Awareness. That's the first thing. You need to be able to notice the freeze response in your own body before you can do anything about it. So, and first of all, absolutely wonderful to do this episode on this because I think this is so important. Dentistry or any medical profession takes so much precision, right? You need to be trained. You need to be good at what you do. You can't be making mistakes, and burnout can lead to that. So, we start with recognizing or having that awareness. So slowing down enough to notice what happens in your chest when you think about that conversation. Where does your breathing go? What stories does your mind start telling you? Most owners have never been asked these questions in any setting. I bet you. I'm sure you don't ask those questions either, right?
No.
Of course not. because we take that for granted, right? Once they can name what's happening, the freeze loses some of its power because it's no longer running unconsciously. It's not underneath, it's on the surface. You see it.
So you mentioned awareness being the first step. What are the other following steps?
Well, the other two I can think of, and we do a lot of these work, especially in trauma work, regulation. What regulation means, it's practical, body first tools, means three slow exhales longer than your inhales before any difficult conversation. 90 seconds of slow breathing in your car before walking in to your practice. I know this sounds very small
Wait,
thing.
go over the first one again for me.
Three slow exhales
Okay.
longer than
Like,
your inhales.
oh,
Yes.
longer. So how long should they be?
You can count it and see how long you can hold that. Just making sure that your exhales are longer than your inhales. So it's you're regulating your body at that point, right? I'm sure dentists do that all the time when they're doing really nitty-gritty work. It's a dangerous place to be in someone's mouth, right? So
Hmm.
I'm sure you're handling yourself in that way. So just being a little bit conscious about it. The other thing, how you can regulate is 90 seconds of slow breathing. These small, like I said, very small, but they're not, right? The exhale activates what we call is a parasympathetic nervous system, which is the part that gets you out of that fight or flight, that freeze zone, right? You can't think your way out of the freeze zone. Remember, your prefrontal cortex is not online, it's offline when you're frozen. You have to breathe your way out. We practice this until this becomes automatic. The
Okay. So,
last,
so sorry to pause you for a
no,
second.
no,
So
go
I
ahead.
believe right now you're talking about regulating
Hmm.
an alert response, right?
Hmm.
To, let's say, you're in the moment and you're feeling a certain way, right? Because of your open loops, because they're
Hmm.
triggering you to, I don't know, make you feel more anxious or make you do the things that you do to cope. So these are some of the easy small steps that will help you regulate those
Hmm.
moments, right?
Hmm.
Okay. Sorry. Continue.
Well, the last one I would say is actually it takes a lot, and it's repair. This is the deepest part, and it takes the longest,
Okay.
right?
So
It
this
can
is going to be the overall repair, right? So
correct.
getting a good handle over our subject matter that we've been talking about this entire
Hmm.
time. So not
Hmm.
just for those moments, but overall, if you want to do something
Overall,
about it. Okay, got it.
correct. So that's the long-term work. That's the inner work that we do for ourselves, right?
Mhm.
We work on these early experiences that shaped your template of what conflict should look like, right? What hard conversations look like in your household growing up. What happened after those conversations, what you learned to expect. And we slowly update that template, that old template, right? So that adult you isn't running on a script that was written when you were 8 years old, right? But we need to update that. We need to do some work. And that's what I do most of the time when I am working with my clients as to repairing those inner wounds, those relationships that we fall back on as a reference unknowingly, unconsciously. Absolutely. We're not doing that intentionally. So yeah, those are the three things I can think about that could lead to a different framework.
Just for my understanding, let me just kind of reiterate the three things that we just talked about. So the
Mhm.
first one is awareness.
Correct.
Now, I'm assuming again, this is awareness on a broader landscape, not just during those moments when you're alerted. Because I feel like, let's say, if I have multiple open loops and it's triggering me to do things that I do for coping, at that point, I don't think I'll be able to bring myself to think about things to make myself aware. I think I would need to wait till my nervous system calms down, come
Correct.
to a point where I could take the time to think about things to be more aware.
I could reframe it a little bit differently. Well, awareness is also not in an overall sense. You can, because there's always hindsight 2020, right? You can look back 2 years ago and be like, hey, I made a mistake there. Well, that's not going to solve the problem because you've already made that mistake and paid for it, probably, right? We need to do this very consciously. So the awareness is naming the response in your body when conflict shows up in that moment, like the shoulders that you notice, the breathing, the stories that you tell
Mm,
yourself.
I
So you
see.
start to notice it before you postpone the conversation. And that alone changes things, that awareness itself in that moment, not hindsight 2020. You're going to lose people by that, right? By that time.
I see. I see. Okay. Well, glad you clarified that. So it can apply to both points.
Absolutely.
Okay. But the repair that so the first one was awareness, the second is
Mhm.
regulation.
Mhm.
And you expanded on that quite a bit. So I believe I'm clear on that. Now the repair part, that's the long game.
Absolutely. Takes a little bit of time.
Okay. Now, speaking of time, and please be honest, how long does this take?
It takes time, I'll tell you that, because it takes time to feel different. It's not a fixed number. Mental health or therapy or counseling is not a linear process, right? Clients will come in and will tell me, I had the conversation last week. I was nervous. I did it anyway, and the world didn't end. Now, I can't tell you that it's going to take us 6 sessions to get there. No, I can't because it's mental work. It's a lot of work. Remember, you have built this system for years and years. It took you maybe 30 years to get where you're at right now. You can't expect that to be over in 30 minutes or even 30 days, right? It's a
Understood.
process. And that's the beginning where we're going to give ourselves a chance to do something different. And from there, it builds on. So, oftentimes I've seen a lot of, because I do a lot of solution-based counseling as well, where there are a number of sessions I may do like 12 to 16 or 12 to 20 sessions, right? And we're going to start working on those issues from day one, right? That's a very different kind of work. Now, looking into your childhood upbringing, that's a different kind of work, right? And the burnout markers that you see in this clientele, it just starts changing over time, right? And I want to be transparent that this isn't, like I said, it's not a 6-week fix. The patterns we're working with took decades to build, right? Updating them will take time. But the pace at which people feel relief, that's usually faster than they expect. So if you haven't done any work versus if you start doing some work, right, it's going to look very different.
Well, we're reaching towards the end of our episode. Before we
Mhm.
end it, is there anything else that you would want our listeners to take away?
Well, seek help. If there is a help you're needing, seek help. There is nothing wrong with that. And oftentimes, mental health looks very, very different than a physical wound because with mental health, you don't really get to see the wound. You experience it for your whole life. And then whole life goes by. And by the time you're 40, you're having these issues and you end up looking at a wall and be like, you're bumping into it. You're not being able to figure out how did I end here? How my practice failing? So seek help. That's what I would say. And look inward. I always say that to my client that it's hard to look inside. It's hard to look inward. Looking inward is very important and the toughest thing to do. Yeah. Toughest thing to do.
Good points. Yeah. Well, thank you so much for being on our episode today. It was really great. Honestly, you gave me different perspectives on
Mm.
looking at burnout and just yourself overall, the mental health aspect of it. Now, if someone wants to find you, how can they reach
Well, before I get to that, I wanted to say something else. And you have to remember, I'm the listeners that I'm talking to directly, that taking care of yourself isn't separate from taking care of the practice you're running. Okay? It's the foundation. The practice cannot run without you. And whatever you're carrying, that's making you tired in a way that vacation doesn't fix, right? And there is a path through it. You don't have to do it alone, and you don't have to figure it out by yourself. So my door is open. Reach out to me. My website is priyankaabulkhair.com. My email is also there. My phone number is there as well. And you can also find me on Instagram at Tread Insightfully. I work with adults on anxiety, depression, multiple mood disorders, and many, many acute symptoms with complex trauma, identity, relational patterns, the things we just touched on today. But
Awesome. Great. Well, thank you so much for being on our episode again, Priyanka. It was a real pleasure.
thank you so much, Ash, for having me.
Thanks for listening today. Be sure to subscribe to Beyond by Wings on your favorite podcast platform. For more information, you can follow us on Facebook, Twitter, and LinkedIn, or reach out to us on our website. You can also shoot us an email at info@eandassociates.com.